the Health Minister, Zweli Mkhize, and the Gauteng MSc, Bandile Masuku, touring infrastructure in Gauteng. Let's listen in now on their conversation.
We are, now rolling with the punches and making sure that we are able not to lose lives and also to lose a lot of time. So thank you for making time. I think we will just maybe the minister will say a word, or you can start asking questions, and then the minister will come in.
Okay, I wanted to find out, MEC, now, in terms of, I know that there's been a worry about the shortages in beds, but now, what about those patients that are not COVID patients who claim that they've been turned away from hospitals, told that there isn't enough space for them or beds for them because COVID-19, of course, patients take priority, but what about those critically ill?
I don't think there will be any clinician who, having assessed the patient, who can turn a patient away. I think all those who are emergencies will be taken care of. You know that we have cancer patients that we can't turn away. We've got maternity patients that we can't actually turn away. So, and other emergencies that are life-threatening that we can't turn away. And those are the patients that we still continue to look after. Yes, we do have a pressure of beds. We have formed a team now that is managing all the beds in the whole of the province, making sure that where there's space, where there's patients that can be taken there. Like today, we're told that here in George Mukhari, they accepted patients that were meant to go to Mamelodi, but they had to come here because there was space available. So the more we master the art of us planning and running our beds nicely, we won't feel much of the pressure, and I think that's what. And the field hospital, that Italy Nazareth is coming on board. By the mid-August, the Tshwane Expo will come on board to cater for all the hospitals here. The main aim is that they should have the capacity for oxygen, but it should be for patients who are fairly stable and who can be stepped down to that level of care. But those who really require critical intervention and management, they will be coming here. This also includes those patients that when we create this space of field hospitals and fever tents, we create space for those who are emergencies in that regard.
All right, Sipho Sterman from SABC TV News. The province MEC has now reached 100 confirmed positive cases, and speaking of the pressure, so I'm thinking people at home who are watching this, what is the message to them? Should people be really concerned? Is the province on top of this now that we've reached 100,000 cases and we are seeing cases increasing by thousands nationally? So as the provincial authorities, I know that yes, you are observing plans here, but not everything is complete. So what's your message to the people at home? And also, a few weeks ago, I think, or 2 or back, there was that alleged incident of a 2-year-old child that was raped in this, or allegedly sexually abused in this hospital. As authorities, I mean, we're talking about school kids that are now going to schools, and there is chances that they get infections, and if they need to be isolated, how can you then talk about, how can you ensure parents that the health facilities will be there and make sure that if their kids should be infected, they'll be protected at these health facilities?
I'm glad you corrected yourself.
Yes, I had.
Okay. Because it's still a case that is under investigation with the police. I think we are saddened by the allegation itself, and it's not our intention to have incidences like this happening within our facilities. I think one of the important things that we have been doing in the past year or two is just to strengthen security, across our hospitals and across our facilities. And I think this is one of the facilities where we had actually put up a very good security system in that regard. And I think let's allow the police to complete their work, but I think it's all about us as a society protecting all our children. It shouldn't be only by government, but the whole community and society to protect our children against people who do these heinous acts. And I think the other part is that, yes, the numbers, we were expecting them. Like I've said, we are rolling with the punches now. So we'd have to respond as quickly as possible to make sure that no patient is turned away from a facility. every patient gets nursed and be managed in a more comfortable way where they can get immediate help. So the fever tents are coming in quite handy for that. Whilst they're waiting, they can receive oxygen, they can receive some form of treatment, and these are plans that we are now in action, we're implementing them.
Are we allowed to pose questions here to the Minister?
Yeah,
right?
yeah.
Okay.
All of us.
Okay, I just want.
I'm not the one in the hot seat.
I just have a question, Minister, regarding, of course, now it's been reported that although now we're talking about a concern and a concern in bed shortages, that there are quarantine sites across the country that are currently not being utilized, although they are being paid for, which is the private accommodations.
I would like to start from there. Let me start from what we're doing here. The reason why we are here was largely to do inspection to see what is the progress in the preparations for the surge as it's coming into Gauteng. So firstly, we wanted to get a briefing from the management, and we're very pleased with the briefing from the CEO, the management, the clinicians, the unions. There's a very encouraging spirit of working together, which is very, very important, because you need all the different strands to be able to pull together so that they can deliver a very strong program to fight against COVID-19. So that's the one area that I was quite impressed with. And secondly, that they don't have problems of PPEs, and that they don't have problems of communication. They can talk through each other to sort out whatever the problems are. The second issue was to have a sense of how the construction of some of the structures is going. The CEO did give us a presentation to indicate that in the past few weeks they've seen a rapid turnaround time in terms of the work that's being done. This is in relation to the work we've put together of emergency intervention teams, where national and provincial offices are going into the areas and make sure that where there's a pressure on beds, we must provide more beds. Now, the third one was obviously to welcome the nurses that we have recruited, and these are paid for by the national department. We're actually coming to reinforce, and we also are aware that the provincial government is going through databases to employ more and more staff. So we're attending to issues of how the institutions are coping. We're attending to the issues of the rollout of infrastructure, the provision of beds, and provision of oxygen and other equipment. We are also attending to the issue of the shortages of staff. So those are the three issues that we came to deal with here. And as I was discussing with the management, the clinicians, it's very, very important that they are supervising and overseeing the plans that are coming in, so that the plans they ensure that the functionality is in keeping with their system and the way that the patient flow is going to be happening here. So this site here is one of those. So inside here you have seen a number of Mkhize, and this is what's happening. Now we've been attending to this concern about the shortages of beds. Now sometimes when people say they've been turned away from hospital, it's because the doctors have felt it was not necessary to admit the person. But where there's a need for admission, the people will be admitted. But because we are seeing the numbers increasing, we want to make sure that the hospitals are moving ahead. The blockage is at the entry level, where people come in and are under investigation, waiting for their results and being assessed as to whether they are COVID positive or negative. The hospital has been well separated so that there are COVID positive areas which are not linked to the rest of the hospital. This is important because the system of running those wards must reduce the level of infection, the PPEs and so on must be adequate, and also the patients must not be mixed. Those who have got other problems must be kept somewhere else. Those who have got COVID must be kept separately. We're very impressed. I've gone around, I've spoken to the staff. Everyone is confident to deal with the issues. Now, the issue that is important now is that this is not where everything starts and ends. Things start at the community level. Quarantine, testing, people who are contacts and people who have been found to be positive need to be taken for isolation, either self-isolation if they are asymptomatic, or they must go to quarantine. We do have a lot of beds which are available, and we are actually opening up those beds because they need to be able to take the contacts that need to be put into those places. So it's difficult to have a stop-start arrangement where if we don't have beds, if we don't have patients today, excuse me, we then close off. The hotels have to be ready with the service, because we no longer know how many numbers we're going to get. Once you start having 20, 30, 40,000 people who are positive, the numbers are going to be increased on the quarantine side. So those beds are going to be used. The fact that they were not being used is because we need to be ready. We've got more beds here that are not being used. We can't say, well, there are no people yet, because when they come, there will be no warning. So that is the issue. The beds are ready to be used. We want to make sure that our system of tracking and tracing is on course, and that the beds are available to allocate to the people who are being sent for quarantine. And here, we don't have, the beds are not full, but we need to make sure that the absorption is improved with more beds, so that people can go into the number of wards. So everywhere in Gauteng, the beds are not full, but it's the blockage at the entry point that we want to relieve, and we're actually happy that it's going on well.
All right, Sipho Sturman from SABC News. Yesterday we had the World Health Organization coming out saying that reopening of schools should be done responsibly, safely, in a context of low community transmissions. Now, we're seeing the numbers rising in South Africa, but here we are still opening the schools. So can you speak to that? It's quite a popular clip that's been doing the rounds on social media. I think it's Dr. Mike something from the World Health Organization that was speaking on this, that countries need to be responsible, not politicize the reopening of schools. It should happen in cases of low community transmissions. If you can speak to that, please.
Yes, certainly. We have been engaging with the WHO. Our conditions in different countries are not the same. Ideally, we should open the schools, open the workplaces when the transmission is low. In our case, we have got a crisis on the one side, in the sense that we need to begin to have economic activities to deal with the problems of the food insecurity, the issues of income insecurity, the high unemployment. So in balancing all of that, we have now got to get our communities to learn to coexist with the virus. We have actually got our ministerial advisory committees, all the pediatricians as well as the other scientists who look after the children. We have asked them to say, give us advice. What do we do with the schools? They have said, no, we can open the schools. And of course, there are these protocols that we put in place. And so whilst we understand what the WHO has said, our approach to the schools is based also on some of the precautionary measures that need to be taken as you go into the schools. It is because we know that we are going to be coexisting with the virus for the rest of the year and up to next year. So we need to begin to adjust to that kind of life with the virus. The precautions that we have got to do with the issues of getting the community to change behavior and ensure that the use of masks for everybody who's outdoors, who gets into any other building, for ensuring that the hand sanitizers, hand washing and distancing, all of those are put into place. So it's a balancing act that we have to work on, but we're very cautious that if we think that there's any risk, we have to mitigate such a risk.
And then just lastly from myself.
Okay, I think we're going to get one last question.
I'd like to ask a question.
Okay, let's take them two maybe in a row, then yeah. You can do your follow-up then.
Okay. Minister, I know that also speaking of news internationally yesterday, Russia coming forward to say that they've successfully tested phase 1 of a vaccine. There was lots of excitement around that, people saying there's hope on the horizon. So just in a context of people that are at home, they're saying this, they're thinking there's a vaccine coming. What is your message in response to this news that there is a possibility of a vaccine, and when will it likely reach us, if it will reach us at any stage at all? And also, we also have issues of medical students that have been volunteering, that have been assisting, but then on social media they've been complaining that there's a shortage of PEEs. They're not, and also they're not getting any form of compensation. I remember the president in his speech, he did thank them for their work, but then they seem to be unhappy with the conditions that they're working under. Can you address those issues and perhaps encourage the students to carry on assisting?
Okay, your last question.
I've got 3 questions.
Okay.
Well, we'd like to encourage the students and all other volunteers and professionals who are offering their services as volunteers, and that we do need their service and would like them to keep up the good work. Insofar as the shortage of PPEs, they just need to address it with the authorities who are overseeing their work, because those are the ones who have got the PPEs, who have got adequate PPEs to be able to assist those who are in the line to serve. So we do expect that if there are shortages, they must be addressed. Now, in all over the country, we are actually encouraging even staff members, unions, to come forward. When they're worried about the shortage of PPEs, that they must explain that, so that we must be able to make sure the distribution is adequate. The issue of vaccine, it's important to say that the vaccines go through quite a number of steps of developments with various trials. You have to do some work in the laboratory. There's a time where we do the research at a laboratory, and it's just restricted to that. Then you move from there. In some instances, you have to go to animal studies, and when it passes through that, then you have to take the next step of doing the phase 1 of human trials, and this tends to be very limited and contained, and this is where you get volunteers who are generally healthy, where they want to make sure that the vaccine doesn't elicit any negative responses, and that amongst the individuals, the response that is expected in the body of the individual is elicited. There's nothing that is untoward. That is what Russia has been able to do. Beyond that point, there's another, the second phase, which now must take into account, the wide use, the various changes, the climatic conditions, the various comorbidities and other conditions that could be affecting the development of the immunity. That stage is something that will have to be done as another phase. So yes, there are trials that are going on. We are already having a team here in South Africa that's involved in the trial, led by the team from WITS. We've seen that working with Oxford University. Same trial is going on in the US and the UK and in Brazil and other countries. So there are going to be many different trials that are going to be taking place, largely under the WHO, which is going to be guiding. We're not yet at a point where we've got a vaccine that is ready. It's good news, yes, but it's work in progress. So in another year and a half or two, we might probably find that there's conclusion where there are vaccines that are fully proven on the second phase of their trials, where we've now been able to establish without any doubt that they can now be produced in millions of quantities, so that they are now able to be used for the whole world. So I think we must watch this space. It's still early days. It's good work that's been done in Russia, but we haven't come to a point where we can just go to Russia and source a vaccine and use it for South Africans. But there's good work there. We're watching all the research. We'll also participate in some of them.
You missed the chance.
No, from eNCA. Minister, we just want to know, we understand at this point that the taxis are allowed to have 100% capacity. But if the virus is airborne, or is it not, why are we not worried about the passengers' safety?
We are worried about everybody in South Africa. We're worried about everyone, and we want everyone to take the precautions. There isn't any part of the country where we think people must just get infected. We wouldn't actually want anyone to be infected. In the case of the taxis, a number of things have actually gone into. We have sat down together and went through quite a lot of consultations to look at the studies of what happened in the various countries. So a number of things have been put onto the table as to what can work. Now, the worst case scenario of how the infection would go on in a taxi is a situation where the taxi is full, people are not wearing masks, and those who are infected are coughing, they are not observing cough etiquette, and that their hands are not sanitized, and everybody is sitting there, the windows are closed. Then that pressure is actually going to give you the highest amount of infection. We have therefore sought to mitigate against that. Amongst the issues, now we've looked at the sustainability of the taxis, the work that has been done by the Department of Transport to look at what numbers of people would actually sustain the industry. Forget about the taxi operator. Let's talk about the industry, objectively now assessed by the department. They realize that what is being proposed will not make it possible to get the taxis to run every day. So we've reached out then to say, okay, let's then look at a number of mitigating steps which are going to negate all of the things that I said are causative factors for the infection to rise. Number one, everyone who must go into the taxi must have a mask. We will actually take action on the operator who will not insist on people putting on a mask. That's why we put it that way. That's why we put it that the owners, the managers of buildings must be the ones who must insist on enforcing the use of masks. So that's the one issue. The issue of hand sanitizers is also important because the handles of the vehicle is where people can actually exchange, contamination and therefore can get infection. So then they must actually take care of that and make sure that people's hands are sanitized. Thirdly, when they go inside, because distancing is not possible, then we've said they must open the windows. Now there's a degree of opening of the windows that is enough to create the flow of air so that the outside air can ventilate and push the air out of the vehicle enough to ensure that the droplets don't have time to settle on the individual. Mind you, with the mask already, it means that if you've got no mask, it's 100% chance of transmission. If you've got a mask and you've got the infection, the other person has got, we reduce the infection chances by about 70%. If the other person has also got the mask, you reduce it by another further 15%, which therefore means ultimately the infection rate, the infection risk is much lower. Now, once you put up the taxi, open up the windows of the taxis, it allows the air to move so that the droplets don't actually stay in the taxi. So we believe that there's quite adequate support to ensure the reduction. Now there's been studies that have been done, and I can quote a few papers for you. One was done by two guys, Matosa and Munyaratsi, who were doing it in the Western Cape, and they went into the taxis to look at the risk of lack of ventilation in the taxis. They actually came out with very interesting studies, and amongst them they put up 14 volunteers, filled up a taxi, and then studied the flow of air and the impact on the passengers. They were able to determine that you don't even need to open all the windows on the taxi. We've got 6 windows, you just only need to open 2 and 2 on both sides. And also you don't want to open all the windows, you want to open them slightly so that there's a direction of the draft of air inside the vehicle and it takes the air out. Now we have then discussed with the taxi industry, and we have said to them, we will then insist on stoppers that will block a certain number of centimeters of the windows so that it's open. This therefore reduces the discomfort of the occupants, but it allows the draft of the air. It also depends on what speed at which the vehicle is moving. They actually found in that study that the ventilation in some of the taxis is even better than the standard that's been put by the WHO in terms of what the flow of air should be inside the taxi. So we think it's a very responsible approach that we have taken. So we have therefore, the taxi operators, the taxi Santaco, NTA, their argument was, okay, how much is it going to be? Very costly. And we said all we want to do is to put a stopper that neither the operator nor the passengers can interfere with the movement of the window, just enough to be able to get the window to open. We'll obviously go into that with that approach. So from where we're, as far as we're concerned, we think that there are enough mitigating factors that we have put in place to reduce the risk. So it's not irresponsible. I think what people confuse is when the taxi operators, at some point they were quite belligerent. They went out and said, we'll do 100%, we won't agree to this and so on. But we were later informed they had a good meeting with the minister. Certainly the National Coronavirus Command Council, when they received the report from the minister, I was assigned together with the minister and some members of the Ministerial Advisory Committee to go through and explain what is the problem. When the leaders of the taxi industry understood, they said, look, we were not aware that the risk is so much, we're going to cooperate. And in that process, we didn't have anyone who was going to insist on their own way. They were prepared to cooperate. Of course, we'll come back and announce, so we'll hear what they've got to say. But as far as we're concerned, we think that it's a responsible approach that we have taken. It takes into account the fact that we don't necessarily want wide open windows. We just need a few centimeters that will be determined is going to be able to help us. But because those studies have been done, we actually feel fairly comfortable that just this angle of ventilation will also make a huge impact in reducing the impact, whether it's a droplet or it's airborne, it should be able to assist us. They did the same study on the basis of viral infection, on the basis of tuberculosis. In fact, these studies were done at the time when they were worried about multiple drug-resistant tuberculosis, and that's why there's quite a lot of studies that have looked into the value of ventilation in the taxis, and I can show that. I can share that with you.
Lastly, Minister, I'd like to know, please. Lastly, Minister, just on oxygen and ventilation, should we hit our peak? Do we have enough?
The current supplies of oxygen and the medical facilities are less than what we will need at our peak. So we're going into a discussion to do a number of things. We're working with the industry now to increase their production, and we're in touch, and they're actually doing that. We're also working with the industry to divert the use of oxygen for health use and not for industrial use. So those two together are going to go a long way towards solving our problems.
I just want to clarify, you said there is enough beds. The blockage is where people need to be to see whether they are symptomatic or not.
Now we just said that at the moment we have not reached our bed capacity in Gauteng. What we have is that the blockages are the delays in the triaging, simply because some people might take longer to be moved from the ward where it's for observation to a ward where it's COVID negative or COVID positive. That's all.
And when we reach our peak,
I just take the minister now.
All right, well, that is the Health Minister, Dr. Zweli, just briefing
This is why we're building this.
So there was the Health Minister there, Zweli Mkhize, flanked by the MEC of Health here in Gauteng, Bandile Masuku. They are touring the sites of hospitals here in Gauteng as the province has breached 100,000 cases of COVID-19.
Indeed, of course, we're seeing there the Minister and the MEC doing that walkabout, inspecting George Mukhari Hospital, just briefed the media, but various issues there were touched on, Tula Sizwe. I mean, starting from, schools being reopened, the issue around the vaccine, also the taxi industry, but also I think it's important to talk about this Russian vaccine, because we were just having a conversation about how some have concluded that this vaccine is definitely coming on shore to South Africa, but the Minister there making it very clear that it's still on various phases where it still needs to be trialed.
Yeah, absolutely. So he does say that there's a lot of promising work that's been done, but I think it's important to say that at this point you cannot talk of a vaccine that has been done and concluded and has passed all the various phases that need to be passed in as far as efficacy as well as safety is concerned. So, let's hold our horses a little bit. Lots of promising work being done, and the Minister there talking about the work being done by the team led by Shabir Mahdi at Wits University. That it's part of the work that's being done with Oxford University. So there's a lot of work on the go, but we're not there yet.
But also, this is not the only vaccine that's been trialed around the world. The United States, the UK, Brazil, those countries are also holding on various trials at the moment. So until one has been concluded, of course, we need to hear official word, from the Ministry of Health. But